ITP is a day programme that's run here at the Maudsley. It stands for Intensive Treatment Programme. So we are here 5 days a week alongside term times. So we have ITP breaks over Christmas and Easter and summer, etc. But yeah, we're essentially a day programme that runs Monday to Friday during term time. And we're designed to help young people who need that extra bit of support and time and structure in order to get things going with their recovery. ITP works with young people who are either transitioning out of inpatient care, or if they needed some further intervention, then they might end up in inpatient hospital. So we try really hard to keep young people out of inpatient care. But more so, we work with young people who would consider themselves as stuck in their treatment, so they need a little bit more time and to ramp up the intensity of treatment in order to help them recover. A typical day in ITP would be young people coming in at 9:45 in the morning. And so, for example, on a Monday they stay later in the day, but they come in and we do day planning, which is where the young people meet the staff and we tell them whether we've got any meetings and tell them what's going on in the day. We usually do a mindfulness task there to help ground them into the day. Then we have a education team here. We've got a small school which was rated Ofsted Outstanding. Young people come for education every day. There's education every day that the programme is running. A big part of what we do in ITP is the therapeutic meals. So obviously that could be a really difficult time for young people. So the staff work really hard to be quite upbeat and calm, but also offer a containing environment for the young people to support them to eat whilst holding the boundaries with the illness. So young people usually stay for 3 meals a day, which is morning snack, lunch and afternoon snack. And then on Mondays and Wednesdays we stay late for dinner. So on Mondays the young people often go out to local restaurants or cafes, or sometimes we eat here. And then on Wednesdays is the family meal. So that's when the parents are invited to bring in a meal that they would usually eat at home, but they eat it here with the other families and with support from staff. A big part of what we do is the therapeutic group programme. So we have a large variety of groups that we run with the young people, and all of them are essentially designed to target the things that can make it difficult to recover, or target the contributing factors to the stuckness. So we have 2 cognitive behavioural therapy groups, or CBT. The first one is for CBT for anxiety, and the next one is for CBT for maladaptive perfectionism. We do radical openness DBT twice a week, so that's a group about managing your emotions and improving your relationships with others. It's a lot about having fun and being open to change and being open to novelty and learning about yourself. We have a group called Who Do You Think You Are, which is a group about self-esteem, values, finding out who you are outside of the illness. And we also talk a lot about social media in that group. We have food group on a Mondays, which is about, sometimes it's theory and sometimes it's like practical, as in like cooking. We also have a group about thinking flexibly. We have a yoga group every Wednesday, and we also have an art therapist that comes every Thursday. So it's like, if you're attending the full programme, you actually get a lot of different help, a lot of different interventions, a lot of structure and a lot of support. There's also the family group, otherwise known as the parent skills group. That's really, really helpful for parents because it brings them all together to discuss about how the week has been, to share understanding, to share tips among each other. And it's also very practical, very skills-based, so they get taught problem solving, validation, meal planning, meal supervision, very active skills that will help them transition that knowledge home to help their young people. A big part of what we do is the therapeutic group program, which is designed to target the things that makes it harder to recover. So it's designed to target the contributing factors to stuckness. So there's 2 CBT groups, or cognitive behavioural therapy groups. The first is CBT for anxiety and CBT for perfectionism. We have a radical openness DBT group, which is run twice a week. That's about your relationship to control. It's about learning about yourself, learning about how to improve relationships with other people, but it's also about having fun and being flexible and learning about yourself. There is a group about thinking flexibly. There's a group about values and self-esteem, which is called Who Do You Think You Are? We also talk a lot about social media in that group because that's really important to our young people. There is a family skills group, which is for parents and carers to come together every week to think about how their week has been, to share ideas, to share understanding about the illness. That can be a really supportive environment for our parents. There's also a yoga group. We have a yoga teacher who comes once a week, and we have an art therapist, and we have a dietitian who does food group, which is about cooking and practical skills in terms of portioning and meal planning, and that she also does kind of more practical learning about the different food groups and the theory around that. When young people come to ITP, they get given 2 multidisciplinary professionals to work with. So our team is quite a big team, and it consists mainly of nurses, psychologists and assistant psychologists, but we also have an art therapist, a dietitian, a consultant psychiatrist, a consultant paediatrician, yoga teacher, and we also have a pets as therapy lady who comes in with her dog every now and then. So with your assigned mini team, you'll be meeting at least twice a week with them. One of those will be a family session. Sometimes we ask young people to come in twice a week for a family meeting, and the other time they'll get an individual therapy session with their mini team. So meal times with young people with anorexia or any type of eating disorder are often very difficult and very stressful times. So we try really hard as a staff team to offer a containing and supportive and calm environment for our young people. Our dietitian works quite hard to put lots and lots of variety into the meals that we eat here. So young people are expected to have eaten breakfast at home, but then they have snack, lunch and snack here with us. But we try and offer kind of, really supportive yet upbeat, positive experience during eating, because we know that the young people find it really hard. To sum up, we know that young people with eating disorders are going through a really difficult period of time in their lives, and ITP aims to provide a really structured, intensive, therapeutic community that offers young people and their families renewed hope that they can and they will overcome this illness with the right help and the right support.